10,000 ambulance staff in England and Wales who are part of the GMB, UNISON and Unite unions are going to walk out on the 21st of this month. Well, for more, joining me now, Christina McAnea, General Secretary of the UNISON union. Christina McAnea, thank you so much for joining us this afternoon here on Sky News. This has been described by all three unions taking part as a last resort. Why Christmas? Why these dates? It's such a sensitive time. You look at the calendar of strike action that's happening up and down the UK from various different sectors. Why did you feel it had to be so near Christmas?
Well, it's not deliberately near Christmas. It just so happens to be that this is the time it's taken to organise the ballot, to get information back from members, and this is that we have sort of time limits within which we have to inform employers. But it's also our members want us to, people who work in the ambulance sector. I say this is we're the biggest union for ambulance workers. We'll be bringing out around about 18,000 of our members who work in the ambulance service on the 21st of December, and none of them want to be out on strike. Not one of them wants to be out on strike. They want the government to come in and actually deal with this. But at this point in time, the government is still refusing. No government minister wants to talk to us about pay. That's the shocking reality of where we are at the moment. So we're not deliberately targeting Christmas. It so happens that the way the timing has gone in terms of the ballot, we've ended up having to we're ending up taking strike action now just before Christmas.
Hey, look, no day's a good day to be without an ambulance service. So, regardless of whether it's Christmas in the new year or later, this is serious stuff. Like you said, it's a last resort. Can you give me a snapshot of what life is like for an ambulance worker? They are there to save lives. That's why they do the job. They take their job very seriously. Talk to me about the need to go on strike. Give me a day in the life, if you like, what life is like.
So, and it's interesting, the past couple of weeks I've been out and visited 5 of our ambulance branches in England, and I've been talking to our members who are paramedics or control room staff, and they are so upset about what's happening to the ambulance service and the impact it's having on patients. So I spoke to a paramedic who was telling me in London, who was telling me that in a 10-12 hour shift, he would maybe have seen 9 or 10 patients. Now he's lucky if he gets to see 3 patients because they're waiting so long at hospitals. Sometimes when he goes into work, he doesn't even get to see any patients in terms of going out to their homes. He gets sent straight to a hospital to basically triage patients in the corridor or in the ambulance before they get into A&E. That's how bad it's got. And another person I spoke to who is a call handler, when I went out to talk to her, she started crying because what she said to me was she can't sleep at night. She's on a shift. She's got a screen in front of her where she's got the list of patients who are still waiting for an ambulance. And she says after the end of her shift, sometimes the same people have been on it the whole way through her shift. And she goes home at night and she worries about them and she cries and she can't sleep for worrying about some of these people. That's how desperate it's become in the ambulance service. So when people say, what will it be like when you're on strike? What can I tell you? Will it mean patients have to wait ages and ages to get an ambulance? Yes. Does it mean, patients will wait ages outside hospitals? Yes, because that happens every single day in the ambulance service. By taking strike action, it probably won't be much worse, if I'm being totally honest, because we will always agree minimum service levels. But just now they feel they're operating at minimum service levels.
Yeah. Striking over conditions and, of course, over pay. We've been hearing from unions like yourself that, there's been a food bank set up at one ambulance station and, NHS workers on the breadline. That's well documented. And you say that minimum cover will be provided on the strike day because the worry for people watching at home is, look, they may support you, but we're not talking about, I think it's your head of health said staff don't want to inconvenience anyone. I mean, sorry for the inconvenience isn't going to cut it if it's a life or death situation for somebody on the 21st of December, if their loved one is involved in a car accident, if they have a cardiac arrest. What would you say to those people watching at home? Because that will happen to somebody on the 21st of December.
Well, hopefully it won't, because there will be procedures put in place to make sure that the most serious incidents are still responded to. So as the example you gave, if there's a serious road traffic accident, ambulance crews will go out to attend. If someone is in a life and death situation, ambulance crews will go out to attend. That won't be affected.
What are the parameters then? Because I'm also looking. What are the parameters then? Because I'm also looking at people putting things out on social media of their loved ones. You know, an elderly cancer patient who fell and he was lying on the floor in the garden, had to be covered up for hours. And I know you will say that that is an occurrence because of the state of the NHS at the moment. But, you know, for that to happen on the 21st, simply because there aren't drivers, I just wonder how drivers or workers in those ambulances, I just wonder how you can justify that.
Well, how can the government justify what's happening now? The example you've just given, I mean, that's what I was saying. I have people who work, our members who are working in the ambulance service now, who are distraught at what they see when they turn up to pick up the example you've given, an elderly patient who's fallen and they've been lying there for 10 hours and there's not enough ambulance crews to go out and deal with that. That is an appalling situation, and it's the government that is to blame for that, not the people who work in the ambulance service.
Yeah, Christina,
they're the ones that are
the government
every single day putting their lives at risk.
How have the government responded to you? Because you're well aware of the picture of what ambulance workers can or can't deal with because they haven't got the resources. The public are aware. The pictures are all over social media. Everybody's got a personal story. What have the government said to you? Because you said you've been ignored. Have they not come to talk to you at all before you announced this strike action?
No. I mean, seriously, no. I did a very short meeting with Steve Barclay a couple of weeks ago, and he clearly did not want to talk about pay. I mean, my colleague, who's our head of health, has also met with him, I think, and he has, again, she says they don't want to talk about pay. That they have not called a single meeting with us to deal specifically with this issue, either about the strike or about how we try and resolve the strike or the pay issues that's causing it. They don't want to talk about it. They're hiding behind the pay review body, which is the body that determines within a limit set by the government. This body will set what pay should be in the NHS, and they determined in England, Wales and Northern Ireland it would be £1,400 flat rate. Now, they took that decision round about, I don't know, April time. People were meant to have that in their pay packets in April. It wasn't paid until September this year. So they had a 6-month gap before people even got that £1,400. By that time, it's worth about, for a nurse, for example, it's worth between about 4 and 4.4%. And inflation's running at 11%. They're in effect being told you're getting a 6% pay cut. And people just can't cope. We're not talking about highly paid staff here. We're talking about, the average pay for a nurse being about between 30 and 32,000, and the average pay for a paramedic being between 35 and 40,000. I mean, these are not huge salaries for the jobs that people do and the responsibilities they have.
Christina McAnea, what would you then say in closing to the Health Secretary, Steve Barclay? This coordinated strike action by the 3 big unions have been announced the 21st of December. There's another strike going on the 28th of December for different NHS workers. What would you say directly to the Health Secretary this afternoon?
I'd say strikes are not inevitable. Talk to us. We've done it in Scotland. We've spoken to the Scottish Government there. We're now out for consultation on an offer there. Talk to us about pay and how we resolve this situation. When he says my door is always open, I don't know what it's open for. It hasn't been open to talk about pay. So what my message to him is now is get serious about this and talk to us about how we resolve this.
Christina McAnea, General Secretary of UNISON, thank you so much for your time this afternoon, talking about the strike action, coordinated strike action by the 3 big unions for NHS workers. It's going to take place on the 21st of December.